hope that we will all have a wonderful and a fruitful experience together during this conference.
Personality in the medical fraternity, and we hope to greatly enrich by your wisdom and experience. The strength of our association is unity, which was proved true again by my past presidents in terms of guidance and support offered. I am extremely thankful to them. I congratulate all the office bearers and team members for having excellent records and successfully completing the term. During my presidency, we have successfully conducted continuing oral and dental education programs, continuing dental health programs in destitute homes and underprivileged sections of the society, reaching out to the rural population by setting up dental camps and imparting oral awareness in schools across the state. There were few areas where my efforts were not fulfilled. The long-pending demand for creation of posts of dental surgeons in all CHC and BSCs has still not been achieved. Presently, there are only 32 in-service dental surgeons in the state, 5 contractual and 17 NHM dental surgeons, whereas there are more than 300 dental surgeons in the state at present. I would like to take this opportunity to request our special guest, who is also a part of our medical fraternity, to be our representative and advocate in the government about our needs and grievances. Dentistry is one of the most demanding branches in medical field right now. It is advancing leaps and bounds, be it in technology, equipments, and applications. But at this point, we have to admit a sorry fact. We do have a lacuna as far as expense is concerned. Everything in dentistry is exorbitantly expensive, and it is only with the help of the government that we can make the treatments affordable and available for the common people by including dental treatments in the Chief Minister's health insurance scheme.
I've been to so many health camps, and one thing I usually ask my colleagues when we prepare for health camps, many ask about what about the medicines, what about the lab technicians. I usually ask, who is going to be a dental surgeon? When you go to periphery, we see lots of patients coming with poor oral hygiene and lots of dental problems. So I see and I feel that any health care in the periphery is incomplete without dental consultation and dental care. As Dr. Moa had just said, he has been practicing for the last 32 years. And if the senior dental surgeon has been practicing for the last 32 years, you can imagine the others. They must be practicing for more than that. And their length of service to the public may be older than many of you. They've done well, they've done their part. And with new technology, with new devices, I'm sure you guys are giving better service to the public. Our health, we normally neglect two things in our health. One is our vision. I'm sure many of you dental surgeons have not gone for eye checkup. I'm very sure of that. So also many of us, the allopathic doctors also, many of us we have never gone for dental checkup. These are the two things we neglect. Without vision, good vision, we can do nothing. And also the oral hygiene, which is in the gateway to our guts, where anything that enters the mouth reaches your guts. Without proper oral hygiene, there are all sorts of diseases. I need not mention, you all know. So, the service that you render to the public about oral care, oral hygiene is the beginning or the initial thing that is required for a good health. There are only 37 regular dental surgeons in government, and around half of that, around 17 on contract. We have around 35 community health centers. Forget about your primary health centers. We have around 35 community health centers. If we are to keep one dental surgeon per community health center, we need 35 dental surgeons. We have now 16 districts. If we are to keep 2 dental surgeons per district, we need 32. We may need 5, 6 in Kohima, Dimapur, and Mokokchung. So rather we need around 40, 45 dental surgeons in only just the district hospitals. Forget about the community health centers. So in other words, we need around 80 to 90 dental surgeons if we are to cover CSCs. Forget about the PHCs. And to have only 37 dental surgeons out of the requirement of around 80, 90, it is my duty, is the duty of Dr. Nisat also. We will tell the government so that when it comes to oral care, justice is done to the public by advertising more dental surgeon posts.
Now we are going digital because we have got digital X-rays, digital chairs, digital restoration and whatnot. So, see, dentistry is advanced so much, especially in private sectors. In government sectors we have tried, but the things that due to lack of fund we cannot proceed much. But our private sector they are doing very well, so we are very proud of them. Government has recognized the importance of dentistry. So even in Chief Minister health insurance schemes, a good number of dental clinics and hospitals were empaneled in the list. Now, another one is Government of Nagaland is kind enough to give us fund for dental council. So actually, this at the rate of 4.5 lakhs yearly. So this till now we are getting for 2 consecutive years we are getting this dental fund from the government. So this is for information.